actually open up and turn the presentation over to our keynote speakers today. We have two wonderful speakers coming in. Our first is Niraj Jetley, and he's a nationally recognized business leader and digital strategist with nearly 20 years of experience working in the industry. He has designed award-winning products for several corporations and is currently serving as the Chief Operating Officer and CIO of NutriSavings. Along with him, he has Susan Ansel, who's the Senior Product Portfolio Manager of Value-Added Products at Harvard Pilgrim. And she's developed leading-edge products with Harvard Pilgrim Healthcare for over 13 years, and is currently spearheading Harvard Pilgrim's Eat Right Rewards program. So we would like to welcome them both, and I'm going to pass the baton over to you.
Thank you for the wonderful introduction, and you did an outstanding job of creating a framework around healthy eating at a workplace. So the title of today's presentation is also focused on healthy eating and helping employers build a healthier workflows. So as we go through today's agenda, we are going to follow a 5-point step where we are going to start off by giving a brief background about Harvard Pilgrim Healthcare and NutriSavings. And then we are going to move on to discussing Harvard Pilgrim's wellness strategy and the importance of nutrition in that. And then we are going to talk about the actual execution of the strategy while rolling out NutriSavings for Harvard Pilgrim's own employees. And once you have the details of implementation details, we are going to move into initial results and our plans for the future.
Hi, this is Sue Amsel, and I'm from Harvard Pilgrim. For those of you who don't know us, Harvard Pilgrim Healthcare is a regional health plan serving 1.2 million members in 4 New England states, in Mass, New Hampshire, Maine, and Connecticut. We have consistently been one of the top-rated health plans in the country by NCQA, or the National Committee for Quality Assurance, and have the distinct honor of being the only health plan in America to have been rated number 1 for 10 consecutive years.
Go ahead. NutriSavings is a part of a global leader called Edenred. Edenred is our parent company. It's a publicly held company operating in 41 countries for the last 50 years, over $1.5 billion in revenue, and primarily focusing on providing employee benefits and corporate services with a very strong background in food-oriented services. The genesis of NutriSavings, which is a spin-off from Edenred, was primarily to help employers reduce the healthcare cost over the long term. And for any employer to help actually reduce their healthcare costs, they need to make sure that employees and their families are actually healthy. Based on several research data points, we identified that in employees' health is primarily a function of 2 key attributes. One, active lifestyle, and second, what they eat. There are many solutions in the marketplace that focus on the active lifestyle by providing a pedometer or other device that can track your steps. But we found out that the market for nutrition was underserved, and that's what led to the formation of NutriSavings. And our mission is primarily helping employers reduce their healthcare costs over the long haul by focusing exclusively on nutrition. It's a lofty goal to focus on nutrition because that's a very challenging field to tackle. And it is challenging because of some inherent issue that we are all faced with. When we are talking about nutrition, the first challenge that we all of us face is confusion. What exactly is healthy? It may change from person to person, and we may debate for the whole day and still may not come to an agreement on that. So that challenge had to be solved. And second challenge was it's a general perception that nutritious foods are more expensive. So, how can we take this objection and convert that to an opportunity? So, to answer these questions, NutriSavings came into existence. And NutriSavings primarily focuses on three core areas to address these two challenges. The first, of course, we wanted to demystify for employees and their families what exactly is a healthy food. And to demystify that, we worked with a panel of dietitians and nutritionists to comprehend and interpret nutritional data from all the food items that we can get from the nutritional panel. And working with a panel of dietitians, we created an algorithm that gives a nutritional score to all the food items. And the score ranges from 0 to 100. Higher the score, healthier the item. So that education becomes very relevant, very pertinent for employees and their families when they go for grocery shopping. The next challenge was how to make it more affordable. So we work with multiple incentives which can be funded by employers, health plans, supermarkets, or food manufacturers. All of these sources can fund incentives that employees can earn to making their healthy food a lot more affordable. And that creates a motivating environment at any workplace for employees to start using this benefit. The next slide I'm going to show you is just going to give you a visual indication on how these incentives work. On the left hand side of the screen, you are seeing incentives which could be funded by employers or health plans. And we are taking an example of an incentive plan that we use in our company, where employees can get reimbursement of up to 20% for any food items that they have purchased that score 70 or higher. And we cap the incentive amount at $30 a month. Now, this is just one example. Every employer may choose to create an incentive plan that fits their need and or their budgetary needs. On the right hand side, you are seeing an example of an unfunded rewards. These are the rewards which are funded by food manufacturers and growers, and the employers and their employees can earn those rewards without having budget set aside for these rewards. So with this as a background, we are going to move on to Harvard Pilgrim's wellness strategy and the role of nutrition in that.
We are proud to be the first health plan in the nation to work with Nutrisavings on developing and launching this innovative nutrition-based wellness offering that engages both healthcare utilizers and non-utilizers alike. We call our program Eat Right Rewards because it is as simple as getting rewarded for eating healthy foods. While I will talk more about this exciting program in a few minutes, our foundational wellness strategy is the key to how this program operates. Wellness is defined as an active process of becoming aware of and making choices toward a healthy and fulfilling life, not merely the absence of disease or infirmity. This was a definition based from the World Healthcare Congress. We recognize above all that wellness is the process of changing behavior, and one size does not fit all. Every employer's work environment, population health, and culture is different, and because of this, our employer-sponsored wellness programs are created to meet the needs of each distinct employer and to attract employee participation regardless of where that employee is on the healthcare continuum. We are proud to be, sorry about that. We pride ourselves on our continuous drive to provide innovative wellness offerings. While we have tried various approaches, some have worked extremely well and some not so much. Some of our failed wellness program attempts were ahead of their time, like Billy the Coach, an online coaching service that we offered over 10 years ago with very little take-up. Healthy Habits Kitchen and the Full Year were both prepackaged healthy meals offered more recently, and these also failed to gain attraction. Eat Right Rewards is one of our programs, like our mindfulness program and Everybody Gets Healthy, our wellness portal, that we believe will be a highly successful in engaging both employers and employees. Harvard Pilgrim has an all-encompassing wellness approach with a wide variety of offerings to meet the needs of our diverse employer and member populations. Some of these include exercise. Exercise is an important part of any wellness program, and we reimburse members for payments made towards the cost of their gym memberships. We offer a comprehensive health screening service for employers that can be tailored to the needs of the organization. These important tools are for measuring baseline health status as well as monitoring progress. We know the peer competition can be a great motivator, so we offer a number of individual and group challenge competitions for a variety of healthy activities. Harvard Pilgrim offers a nationally recognized stress management program called Mind the Moment. This program teaches mindfulness techniques to help deal with life's stressful moments. Well, these are all great wellness options for our employers. We were excited when Nutrisavings approached us with this nutrition-based wellness program. And here's why we got excited. It has traditionally been difficult to engage a large number of employees in wellness programs. The uptake is usually about 10%. Some people will never go to a gym or will not take time to spend on stress management techniques, regardless of their stress level. However, everyone has to eat. With Nutrisavings, we found a program that we believe has universal appeal. So what are the benefits of this program? First and foremost is education, an education-driven behavior change. Eat Right Rewards is not a diet program, and we don't expect measured shifts in eating behavior that cannot be sustained over time. Instead, we're looking for some incremental changes, and most importantly, we want employees to learn about the nutritional value of what they're eating. Everyone has a different diet. I may be a carnivore, and you may be a vegetarian or a vegan. I might eat healthier or less healthy than you. This is not a contest. We're not trying to win a prize. The only person I need to compete with is myself. If I change my eating habits a little bit each week or each month, I will become healthier. You are what you eat. Every food item has a nutritional score, and every time you shop, the nutritional score gets reported back to you. We already heard about the scoring system from Niraj. So the best score is 100, and you get those for fresh fruits and vegetables. And a 1 is the lowest score, and those you get for things like soft drinks, Coke, Diet Pepsi, etc. Eat Right Rewards provides healthier alternatives for food items that score lower than 100. The program also includes healthy recipes and articles. Eat Right Rewards includes online coupons to help employees save money for purchasing healthy foods. Employees can earn as much as $150 to $200 a year just by taking advantage of these e-coupons. Now that's real money. Behavior change results in incrementally eating healthier over time, And when employees and their families eat healthy, healthcare costs go down and employee productivity goes up. Now I'm going to talk about how we rolled out this innovative program to our employees. With this innovative new wellness program, Harvard Pilgrim decided to pilot Eat Right Rewards with our own employees first, and this started in October of 2013. We did a multi-pronged promotional communications campaign prior to the launch, focused on intranet communications and signs posted in our cafeterias. During the launch, we held open enrollment meetings and seminars where employees signed up for the program on the spot and entered raffles for early adoption. To test the impact of different components of the program, we decided to take a stepwise approach. We initially launched the basic program, which included an educational component, which is the nutritional scoring, and coupon-based savings. During the first 6 months of the program, we got 28% of our members to sign up and use the program. We should have been happy with this participation rate. Our target was 20%. But we wanted to see if we could do better. So in April of 2014, we added employer-sponsored incentives to the program of up to $20 per month. We designed our incentives to pay $10 for sign-up and $10 for an average monthly score of 60 or higher. With this change in the program design, we saw a sizable jump in enrollment to 42% of our employees. We also made program enhancements based on participant feedback. These included modifying coupon selections to add fresh produce, making website enhancements, and launching a mobile application. We highly exceeded our program participation goals, and we expect this growth to continue as our engaged employees continue to share their stories with their peers. Our employee population played a big role in helping to achieve the results we got. Our HR department designed the program based on our specific employees, consisting primarily of young to middle-aged women. And the employee enrollment process was simple. Employees learned about Eat Right Rewards through a communication campaign offered through the HR department. Next, employees enrolled in the tool, added their grocery store loyalty cards, and started using the program. Once enrolled, employees got access to online coupons for healthy foods. As we've learned through the program, every Tuesday, participants get an email with new online coupons. This week, we got a coupon for bananas. This is an illustration of one participant's shopping trip. The employee's grocery store receipt is on the left-hand side of the screen, and it shows that fruits and vegetables have high scores of 100. This includes, the avocados, apples, onions, and peppers. The low-scoring items were pudding and pizza dough. Next time, I would buy pudding, but I would try to find one that had a higher score. And that's the beauty of this program. This shopping trip has a very high score, and it scored a 75. And this person earned $4.50 by activating and using online coupons for avocados, apples, peppers, and lime juice. The employer incentive on fresh fruits and vegetables brought in almost $4 additionally, for a total of over $8 cash back on this one shopping trip alone. This is real savings, and you could see how it can add up throughout the year. Through our pilot, we learned how important promotion is as a key driver of program uptake. Our comprehensive promotional strategy gained more adoption within a few months than we had as our overall goal for the entire year. Another key driver of program success is executive leadership support. Our leadership team showed strong support for this program through emails, staff meetings, and blogs. Our HR department supported the launch through a variety of employee communication vehicles, such as emails, posters, and open enrollment events. The final key driver of program success is incentives. Employer incentives increase adoption dramatically. Without incentives, participation rates will be lower. It's a given. Our Eat Right Rewards participation rate jumped from 28% to 42% by just adding moderate incentives. We offered two types of incentives: participation-based and outcomes-based. Participation-based incentives gave employees money for enrolling in the program and shopping at least once per month. This type of incentive was used to increase program participation. It's not based on what you buy, just that you use the program. Outcome-based incentives are different. They include a target goal that the participant has to reach to get rewarded. Our score was 60 or higher. According to the panel of nutritionists that created the scores for the food on this program, a score of 50 or higher is considered to be healthy. We wanted to do a little better than that. Lastly, online coupons make buying healthy foods more affordable. In summary, there's no motivator like money. We found that cash rewards have the most direct impact on program participation rates. Now I'm going to turn it back over to Niraj, who will talk about the initial results and future plans.
Thank you for the background, Sue. So I'm sure from what you heard from Sue, you got a very good understanding of the importance of communication and the importance of executive support while rolling out any worksite wellness program. And of course, nobody can deny the importance of employer incentives. One of the key things we have learned during our experience with Harvard Pilgrim is ensuring any kind of communication going out to employees must address employee privacy, because there is a usual concern that I don't want my employer to know what I'm eating or what I'm buying. So we just wanted to lay it out in front of all the audience members that as a part of our privacy policy, employer or health plan would never know what the employees are buying, number one. Number two, it's a completely optional program where employees are opting into the program by simply enrolling their loyalty card. So with that as a background, let's move over to the exciting part of results. Almost every wellness program focused on nutrition traditionally talks about conducting cooking classes or coaching classes, but the return or the actual participation is very hard to measure. We are very fortunate to have a program like Nutrisavings that can actually measure the change of behavior while measuring ongoing engagement among employees. So when we rolled out the program, our long-term goal was and still is to help employers reduce their healthcare cost. But that's over the long haul. What kind of metrics we can put in place for the short term and the medium term so that it can give us an indication if we are heading in the right direction or not. The first and foremost goal was to create a meaningful employee participation. As you heard from Sue, based on industry stats, and usual wellness programs have around 10 to 12% participation rate. Harvard Pilgrim HR department outlined a goal of 20% participation over the first 12 months. And we reached 28% participation in first 3 weeks of program rollout. That was incredible. First 3 weeks and the employees were still signing up week after week after that. And then we introduced employer incentives. So we wanted to make sure we have got meaningful participation. The medium-term goals we outlined were to track the behavior change. Keep in mind, this entire program resides on the fact that the employees, when they're going to grocery store, are actually remembering to scan their loyalty card. If for some reason they forget to scan the loyalty card, I cannot track their behavior change. So it was very important metric for us to keep a track of to ensure we are trending in the right direction. And second, we wanted to track if there is any change in shopping pattern. And last but not the least, we wanted to see are the shopping scores actually improving or not. So these were the three segments of goals we have outlined with Harvard Pilgrim team. And we are going to talk about the short-term goals. Well, this graph explains everything on its own. We launched in October 2013, and within 3 weeks we got more than what we were looking for. And then in April 2014, employer incentives got introduced and numbers speak for themselves. Right now we are at 42% participation rates, and all of these employees are highly engaged and highly motivated, where they are going for shopping on a regular basis and scanning their loyalty card. So with this short-term goal under our belt, we move our focus to the medium-term goals. The first medium-term goal was to track are employees actually remembering to scan their loyalty card. And the indicator was for that was to track number of grocery store trips per employee per month. Now, based on several industry stats, we know that usually shoppers go to grocery store between 1.3 to 1.5 times a week. As you can see from the graph, we have seen a steady increase in number of grocery trips logged in per employee that have gone from just below 7 to just about 8 shopping trips a month. That means 2 shopping trips a week, which is higher than industry average of what we were using as a baseline. So with one behavior change going on the right track, we moved our attention to tracking, is there any behavior change in shopping patterns? And this is my favorite graph of all. Based on the initial rollout strategy that Sue shared with you, we started with education for all the employees. We were educating the employees about the value of eating a serving of fresh fruits and vegetables, and the value that they have, which is a score of 100. And we just wanted to take a step back and visualize, are employees really getting the message? And this graph explains it. In October 2013, if we are looking at all the shopping trips that we were getting from the grocery stores, only 30% of those shopping trips were having at least one serving of either fresh fruit or fresh vegetable. Fast forward it to February 2015, and we are seeing 90% of the shopping trips today are having at least one serving of fresh fruit or fresh vegetable. This is a huge jump of 60% in just 12 to 13 months of time. So this goes to prove the point that communication was very effective in terms of employees learning the benefit of healthy eating. It also goes in to prove the point that incentives do help in changing employee behavior as well as support of executive leadership. Next, we are going to talk about actual behavior change and segmenting by employee. This slide talks about the change of an average monthly score over a period of time. I'm going to take a step back and put this graph in a context for everyone. As Sue mentioned, this is an education program and you are not competing with anybody else but yourself. So if Sue and I are working for the same company, I have no reason to compete with Sue. All I want to do is behavior change at the pace that I can sustain over the long haul. So if you can see in the graph, Gen X started with a very low average score on a monthly basis, just around 50 on a monthly basis. They continue to make progress. And what we are finding out is every employee has a different habit to change. Some employees want to start off by making a healthier breakfast choice. And some employees want to start off by making a healthy dinner choice when they are going for grocery shopping. But it is a continuum that you are not under pressure to change and change now. Change it at your own pace. This tool is giving you a guided shopping companion every time you go for grocery shopping. And this graph beautifully depicts the overall behavior change over the last 13 months or so. So with this background and with the success that we had with Harvard Pilgrim's own employees over the 12 to 13 months period, in October 2014, just after an annual launch of the pilot to its own employees, Harvard Pilgrim decided to fully embrace and adopt this program and became the first carrier in the country to offer this to the entire book of business. So Harvard Pilgrim currently has got fully insured and self-insured book of business. For them to offer it to their book of business, we had to go through an accreditation and approval process from the Department of Insurance in different states. Once we had the approval for the fully insured population, we worked with their sales and marketing teams and actually trained them so they can talk to their counterparts at the employers. NutriSavings is actually making outreach communications to all the small employers which are fully insured. And this program went live for their own subscribers in October 2014. And in just under 6 months, we have several of their fully insured clients already live using Eat Right Rewards. On the self-insured side of business, which are usually larger accounts, we are setting up meetings with those accounts on one-on-one basis to educate the wellness coordinators and HR benefits administrators about the benefit of this program. And again, in the last few months, several of their employers have gone live. Last but not the least is the broker community. Health plan is a business which is supported by brokers being on the field. And it was very important for Harvard Pilgrim to differentiate themselves in the marketplace. And that could have been done only if brokers have got access to the program. So today, brokers have got access to the program and they can use their mobile phone app to show to the HR administrators about their own shopping behavior and the impact it had on their own personal as well as family lives. So with that, we are going to stop the webinar and we'll be here to answer any questions that you might have.